What causes functional versus organic constipation in children? Imagine your child's tummy feeling uncomfortable and their bathroom visits becoming a struggle. Sometimes, this is due to what doctors call functional constipation, and other times, it's caused by an underlying medical issue known as organic constipation. Understanding the difference helps parents and caregivers know when to seek medical help and what kind of treatment might be needed. Most cases in children are functional, meaning there is no structural or nerve problem in the bowel. About 95% of constipation cases fall into this category. These children often have no physical abnormalities causing their symptoms. Instead, their constipation is linked to behaviors, habits, or emotional factors. For example, children might start withholding stool because they are afraid of pain from passing hard, dry stools. This can happen if they experience discomfort or pain during a bowel movement, leading them to avoid going altogether. Over time, stool stays in the colon longer, becoming even harder and more difficult to pass, which makes the problem worse. Changes in routine, like starting school or new environments, can also trigger constipation. Kids might feel stressed or anxious, which can cause them to hold in stool. Dietary habits play a big role too. If a child eats too little fiber or consumes a lot of dairy products, their stools can become hard and painful to pass. Sometimes, children develop constipation after stomach infections because their bowel habits get disrupted during illness. Psychosocial factors, like stress at home or wanting control, can also contribute to stool withholding. Organic constipation is less common, making up about 5% of cases. It happens when there is a real medical reason behind the problem. For example, some children are born with Hirschsprung disease, a condition where nerve cells are missing in parts of the colon. This causes a blockage because the muscles cannot work properly. Other causes include neurological disorders like spina bifida, which affect nerve signals to the bowel. Metabolic or hormonal issues such as hypothyroidism or diabetes can slow down bowel movements. Certain medications or toxins can also interfere with normal bowel function. Diseases like celiac disease or cystic fibrosis may also cause constipation along with other symptoms. Children with organic constipation often show additional signs beyond just difficulty passing stool. They might have delayed passage of meconium as newborns, poor growth, or neurological problems. These clues help doctors identify if there is an underlying condition that needs specific treatment. In summary, functional constipation in children mainly results from behaviors, diet, and emotional factors that cause stool withholding and hard stools. Organic constipation stems from structural or systemic health issues affecting the bowel. Proper diagnosis involves careful medical history, physical exams, and sometimes tests to determine the cause. Treatment for functional constipation often includes education about healthy habits, increasing fiber intake, and behavioral strategies. Organic causes requiring targeted medical interventions to address the underlying disease or abnormality. Always consult a healthcare professional for personalized advice and appropriate management.